Just recently, the increase in infection across the country has marked 100,000 in terms of the infection rate, making Nigeria the 8th most infected country in Africa. The update, obviously, of COVID-19 pandemic is the fact that this second wave is on, and the new strain is quite dangerous, and many more people have died in recent times. Could you give us a quick overview of the reports and the data you have concerning the new strain of COVID-19 and how it's been, how your team is working to combat it?
I was saying, I just wanted to clarify that we haven't confirmed the new strain, the UK or the South African strain in Nigeria yet. We have been sending samples to Redeemers University through NCDC, but we are yet to get those results. Having said that, there's no doubt that the numbers have been increasing. We have now crossed the 100,000 mark. We have just over 1,300 deaths. And what's worrying us really is the fact that our treatment centers are now starting to get overwhelmed. Here in Abuja, for instance, we have to struggle to get places for people requiring beds for oxygen or for ventilation. It's really becoming tight. Well, we've continued to do a lot of risk communication and community engagement, but at the end of the day, it all boils down to people's behavior, our risk perception. We really need to stop having mass gatherings. We need to be very sensitive to our environment and the people we meet.
Sir, for me, one of the reasons why we have a spike is the body language of our leaders. Aside the conspiracies that there's no COVID, most of these leaders are making policies that are working against the fight. So we have the NIMC right now, all their centers crowded because our government chose this time to make policies that would require people to be, cramping and crowding places, public places, where we don't even have a cure, a vaccine or anything on ground to expose our people like that. So
we have looked at their processes. We've worked very closely with them. It's very clear if you get into their offices, it's actually pretty well organized. But the problem is outside these offices. And we will continue to engage very closely with both NIMC and communications to make sure that there are enough security people, enough staff members to make sure that the crowds are controlled outside. Dr.
Aliyu, it is a fact that the protocols at the NIMC centers presently are not being obeyed anywhere. Even their strike that just got called off got another crowd yesterday. Is there a possibility the PTF would direct that registration should be put on hold and the deadline shifted even further till we are at a place where we think it's okay to try to do this? Or a different method of registration is done?
We definitely need to work together. I know NIMC has closed some offices where they've had problems, and whenever we see these issues, whether it's online or on TV, we pick up the phone straight away and speak to the relevant authorities. We don't shirk in that regard, and they know our feelings clearly.
Many experts have said that it would be wrong for Nigeria to do a full lockdown, especially because it will hurt us economically. This morning or yesterday, ASU was saying that they were going to have to postpone the resumption for schools. In your view, do you think we actually need a lockdown, and can we even survive another lockdown?
There's very little appetite for a lockdown, whether it's with the PTF or anybody else. We know the impact this will have on the economy. A lot of our people have to go out on a daily basis to seek their bread. But what we've been saying repeatedly is, because all of us don't want a lockdown, we need to make sure that we do not reach that stage where it becomes inevitable.